like the Medicare rates for anesthesiologists is the worst rates ever. So when they came up with the Medicare rates for anesthesia, they get paid less than the Medicaid rates. That's how bad it is. Oh yeah, they get, I think Medicaid rates per RVU is like $30 and they get like 21 for Medicare. So it's like, you know,
so
21 an hour.
So for people,
21 per RVU.
So for people who don't like recognize how important that is,
that's less than a plumber, $80 an hour.
Yeah, but every procedure you need anesthesia to be put under. Anytime you put under, and this is like clipping away at a critical point of your care.
Blue Cross Blue Shield was just about to instate this. Was it in New York or Maryland? Where was it?
I don't know.
It was somewhere in the East Coast. They were about to instate.
Just like barely got to the end of the sentence. It was just like, yeah, I seen this coming.
Yeah. Well, they were about to instate, like, if the cases take longer than they're supposed to, we're not going to pay the anesthesia past a certain amount. It's a set limit.
It's like a 2.5 hours for this procedure, 30 minutes for that procedure.
Which that's probably good for, like, if you're going towards a one healthcare, like, for all type of thing, because one thing's going to happen. Anesthesia is going to be like, that case is canceled. That guy's obese. He has coronary artery disease.
Way less
case is going to take 6 hours, and it should only take, I'm only going to get paid for 3.
Way less cases.
Or he shuts off anesthesia after 3 hours, see what the surgeon
Which
can do.
one's the better outcome? Yeah, that might happen.
Yeah, don't take care of the patient.
Another
But this kid saved that. This kid saved that. This kid's shooting of the CEO of UHC made BCBS retract back on it, which, you know, who's going to take longer? And the other thing is, like, who's going to work with surgeons that are going to take longer too? That's going to be like,
or like you said earlier today, more complicated patients.
Yeah.
Who wants to take on the risk, more complicated patients? Like, you're going to, like, deny
because they'll start with anesthesia and then it's going to go to the surgeon.
Or it doesn't even have to. Yeah. Like, you have no option.
Yeah.
Yeah. Go ahead. Like, we have an anesthesia shortage already. Like, what's it, 3,000 in the country or 5,000?
Yeah, I think by 2026, it's even higher.
It's like 3,000 now.
Yeah.
And then get more anesthesiologists to say no to you. So this is a way to, like, clip away at costs, I think. And I think it's directed.
Yeah.
You know what I'm saying? Okay, you're not saying I won't do the surgery.
Yeah.
I won't do anesthesia long enough to do that surgery.
Yeah.
And you can't put the 2 and 2 together. You can't be like, oh, no, that's your insurance company.
It would create a lot of fights in the operator. Like, I
don't think so. I think it would just be a lot less cases done.
Yeah.
The fights would be avoided. Like, the patients at their, like, it's a secondary way to deny surgery.
And, you know, the anesthesia groups are much bigger. So, like, certain surgeons, like, they would be, like, chopped off. Because, like, nowadays we have EMR, which records how long people take on average to do certain cases. Yeah. And, you know, sometimes, like, I'm like, I never booked that much time for this case, but they take my volume average and they have it. It's always over what I actually take. So,
definitely is.
People would definitely just look at it and be like, we're not working with this guy.
Yeah. And I mean, the other thing is, like, if, say, something happens in the OR during a case and you're taking care of a patient, and now it's like being pushed to finish a case earlier.